Hello imposters, welcome to the very first case in this collection of high-yield USMLE cases. Let's get started. Our case today is a 66-year-old diabetic Caucasian man who presents to his primary care physician after noticing yellowing of his eyes and unintentional weight loss of 22 pounds in the past year. On physical examination, he denies abdominal pain, but you palpate a mass in the right upper quadrant. Lab results show alkaline phosphatase 127, bilirubin to be 6, and calcium to be 10.6. So I want you to think about what your diagnosis is, the usual presentation, and some risk factors for this disease. The diagnosis of this patient is pancreatic cancer. Some things that should have gone off in your head are yellowing of his eyes and jaundice, leading you to think about something related to something blocking stuff around the liver. Jaundice is usually due to biliary obstruction from the pancreatic tumor, causing accumulation of bilirubin. This not only can cause jaundice, but it can also cause pruritus or itchiness in the skin. Whenever you see someone having a mass or something wrong in an area, but they don't experience any pain, it's a pretty good indication to think about cancer. The massive unintentional weight loss here, 22 pounds in a year, that should have made you think about cancer as well. The high yield wording for pancreatic cancer is painless jaundice. Pancreatic tumors are mostly adenocarcinomas and are usually found in the head and neck of the pancreas. It can invade into the duodenum, the ampulla of Vater, or the common bile duct. Some risk factors to keep in mind are chronic smokers. Smokers have a 6-time higher chance of developing this type of cancer. High alcohol consumption and chronic pancreatitis, which alcoholics can often have. These are kind of some risk factors. Other risk factors are being male, having a diet high in fried meats, and African American patients are considered a high-risk group. Something that is super high yield is the tumor marker for pancreatic cancer is CA19-9. There aren't many tumor markers that start with C, but something, if you wanted a mnemonic, you can kind of see that the number 9 here kind of looks like a pancreas. If you set it out on sideways, it kind of looks like a pancreas to me at least. Or you can kind of think about the age 19 is somewhat close to the age of drinking. Alcohol kind of causes pancreatitis, which increases the risk for pancreatic cancer. Or actually in Canada, the age of drinking is 19 instead of 21 in the United States. For labs, you're usually given the bilirubins, the ALTs, ASTs, and alkaline phosphatase. Whenever I see these labs, the first thing that pops in my head is if something is elevated, it's usually because something is blocking a duct or a passage, and that blockage can range from being a stone, or if it's in a baby, it could be a developmental defect, or in this case, obviously it would be a tumor. I don't exactly suggest you to memorize these normal values here, but the more questions you do, you'll kind of get a sense of what range they'll be. So whenever I see phosphatase, as long as it's above 100, like it's 3 digits, I kind of know that it's a little abnormally elevated. Whenever I see anything that's pretty much above 0 point anything, like above 1, it's usually pretty elevated. Calcium, anything pretty much above 10 or lower than 8 is pretty abnormal. So you don't need to do like flashcards to memorize these exact numbers, although maybe that would be helpful in the future. But I mean, these are going to be in your electronic medical record anyways, but for testing wise, it's kind of helpful to memorize and just get yourself familiar with these things. The elevation of calcium here is a bit vague. In this case, it could either be from the parathyroid hormone-related protein secretion causing the hypercalcemia. It could be the kidneys are not working as well as they should be to urine out the calcium, and that could be, maybe he's a diabetic patient. The calcium here is not really the main point of this case anyways, but just something to kind of think about as that has shown up in other questions as well. When you're doing your NBME practice exams, UWorld or AMBOSS or other questions, get yourself familiar again with the lab results. Get yourself familiar with where the button is and how you can find them. So you can, for some test Q banks, you can do like Control F, but they'll usually have a section like a search bar over here that you can type in like the first 3 letters of the lab value that you're looking for. So for like alkaline phosphatase, I probably would have typed in like FOS and something would probably pop up. And I'll show you on the next slide what your lab values will look like on test day. And I'll also show you a PDF that you can download that's written by the NBMEs that have lab values that you can use when doing your practice questions if you don't have have access to lab values. Another tip that I have shared with other people and that they found useful is whenever you have lab results in your question is how you highlight them. So you might highlight them, so you might highlight them saying like, oh, this is abnormal, and I'll highlight this. So bilirubin is abnormal, I'll highlight this. Calcium is a little bit abnormal, I'll highlight this. So instead of doing this, what I suggest is, let me clear off the ink here. What I suggest is when let's just say this one is elevated, you would highlight the actual numeric value. Let's just say direct bilirubin, let's say this was actually low, abnormally low. I would actually highlight the lab and not the value itself. Let's just say calcium is elevated, and I would highlight the second number, the actual number. And so when you maybe lost your track of thought, or when you're coming back to look at the lab values after you've glanced at the answer choices, this is very helpful to immediately see, okay, bilirubin is low, this is abnormally high, this is abnormally high. If you had highlighted all the values, then you don't see that immediate feedback of like, okay, so high, low, high. So this has been kind of a helpful trick for some students to save a little bit of time, and just a good habit to have in the future. Here are the lab values you'll see on test day. This is from the free 120 website, which I'll also link in the description box. So as you can see, this is you should be kind of familiar with this as you're doing your UWorld or AMBOSS questions maybe. It's highly recommended to take this free practice exam closer to your exam date, either on your own computer, or you can schedule with Prometric to take it at their site to kind of get yourself comfortable with the testing environment and such. So this is a very highly recommended practice question, but you basically type in phos here, and then it'll automatically highlight alkaline phosphatase, which is right here, and it'll tell me the reference range right there. These are the official lab values from the NBME. This is a PDF, which I'll link in the description box that you can download. This is super helpful if you're doing practice questions, not in an interface that allows you to have lab values as useful. I think alkaline phosphatase is probably in the lower end here, but you can also use this and use some of the reference ranges here. And again, I'll link the access to both of these in the description box for you. Here is our visual slide. This is jaundice with yellowing of the skin due to biliary obstruction from the pancreatic tumor. You can also see sclera ectoris here, which is essentially just yellowing of the sclera. I also put Alex Trebek here just because he had a 2-year long battle with pancreatic cancer, and he unfortunately sadly passed away in 2020. So a lot of people kind of knew him towards the end of his life, knowing him as a pancreatic cancer patient. Most of the pancreatic cancers are in the head of the pancreas. I've included an image here to kind of help you with the anatomy. Remember, in some previous slides, we talked about that the tumor marker is CA19-9. So you can kind of see here that it looks kind of like a number 9 here on its side. So CA19-9. Metastasis for pancreatic cancer often begins in the regional lymph nodes and spreads to the liver, or less often to the lungs. My general rule on guessing for metastases sites is kind of seeing where the blood flows to and out of the organ. So there are arteries and veins connected between the pancreas and the liver. So that kind of makes the most sense that the liver would be the next met site. Although that is the case that, I think about blood flow, pancreatic adenocarcinoma spreads via the lymphatics. So in this picture here, it's a section of the liver, and the general rule is if you kind of see these cancers, there's multiple lesions, it usually means it's mets. So let's just say that everything here was normal, and there was probably only one lesion here that is usually a primary cancer versus a secondary cancer, or a cancer that has metastasized into this area. Here is a H&E stain of pancreatic adenocarcinoma, which I won't get into too much detail. Here is what it would look like on an axial CT. You can kind of see like the pancreas here, and then it looks like there's a tumor in the pancreas head. Here's the liver. Looks like this is the spleen. And looks like this is a kidney, or maybe one of these are interchanged, but you can kind of see the pancreas. This is the stomach. Get yourself oriented on how you can read these axial CTs. I think more recently there has been student feedback that knowing how to read these CTs and just knowing the general area of things have been very helpful. Prognosis for this cancer is unfortunately very poor. Around 90% of patients die within 1 year of diagnosis. However, if resection of the cancer, like through the Whipple procedure where you remove the pancreas head, the duodenum, gallbladder, and bile duct, it's possible. And, if the patient or if the disease is caught in an early stage, the patient's 5-year survival increases to 30%. Here is our summary slide. The topic for today was pancreatic cancer under hematology and oncology. The first 8 pages for more reading is 407 and 408. The high yield munchies for this case is pancreatic cancer often presents as painless jaundice and scleroactinis with weight loss. Tumor marker is CA19-9. Smoking and chronic pancreatitis are risk factors, and this disease has a poor prognosis. As usual, again, I pasted the lab values PDF from NBNMe and the free 120 website in the description box, so feel free to use that. Something I forgot to mention in the overview video is I created these cases from my own experience studying for STEP. I've tried to cross-check them with resources like UWorld, First Aid, and Amboss. Let me know in the comments section if you have any questions or comments on this case. Thank you so much for your support and liking the video and subscribing. I'll see you in the next case. This is Imposter Med signing off, and as always, be happy and be kind.